Hi, I'm Jeff Johnson. I'm the State Director of AARP Florida. Welcome to the snapshot of long term care in Florida. We'll do a checkup on the state of our long term care system and discuss ways to modernize it. And I just want to invite you to keep an open mind and think differently about how Florida delivers long term care services. First, let's answer a basic question. What is long term care? Long term care services help people with chronic conditions maintain their level of functioning. If individuals have physical illnesses or disabilities, they often need help with activities of daily living, or ADLs as they're called. Now, for the purposes of this video, we're going to focus on residential long term care, which includes nursing homes and assisted living facilities. Home and community based long term care is another option, which I'll touch on later. Activities of daily living are basic activities necessary for independent living. There are five categories: personal hygiene, like bathing and showering, grooming, nail care, brushing teeth, those sorts of things; dressing, being able to make appropriate clothing decisions and physically dress and undress yourself; eating, the ability to feed yourself, though not necessarily the capability to prepare food; maintaining continence, being able to mentally and physically use a restroom. This includes the ability to get on and off the toilet and cleaning oneself. And then transferring or mobility, being able to stand from a sitting position as well as to get in and out of bed. The ability to walk independently from one location to another, those are all parts of that transferring mobility activity of daily living. So the level of independence for persons needing long-term care is based on whether they can perform these activities on their own or whether they need help from caregivers. You might be asking yourself at this point what this means for you and how it applies to your life. There are three key points that I want to make here. The first is that the 50 plus are an incredibly powerful part of our economy. A recent AARP study found that Americans aged 50 and up contribute so much to the US economy that they'd constitute the world's third largest economy if they were counted as their own country. The age group also creates jobs, provides caregiving, and builds opportunities for all. Second point I think you should keep in mind is that as a taxpayer, your money is contributing to the state's plan for long term care. So it's your money and your voice should matter. Third thing I want to say is that if not now, then one day in the future, you or a loved one will likely need to make important long term care decisions. So it's good to know what system is in place right now. Now, it's essential to recognize that the Sunshine State has the fastest growing population of older adults, 65 and older, of any state in the nation, and that these individuals will soon account for 30% of Florida's total population. Let's give that fact some context. Seniors account for 60% of the state's total economic activity. The retirement industry, if you will, is Florida's second largest. It's a major part of what makes Florida Florida. As an example, monthly Social Security payments from Florida retirees are approximately $7 billion. And that's just the payments, not the churning that happens in the economy as older Floridians spend that money. In short, the state has a longevity economy that's driven by Floridians 50 and older. And it's vital for that longevity economy that Florida has a healthy and safe long term care system, a system for which taxpayers fund about 70% of residential facility care costs. But we're here to pose this question: is Florida's long term care system ailing? The answer is unequivocally yes. So let's take a look at the numbers and take Florida's long term care system through a checkup, if you will. What are the symptoms that signal Florida's long term care system may be failing? Well, to date, more than 62,000 Floridians have died from coronavirus, and over 11,000 of those deaths were in Florida's long term care system. So that's one in six coronavirus deaths that are occurring in Florida's long term care facilities. Upon reflection, it's tragic, but it's not surprising that so many of Florida's long term care residents have passed away during this pandemic. For decades before this global health crisis, infection control was a significant issue for nursing homes and assisted living facilities. Continuous lack of trained, qualified staff available to work in these facilities was a growing problem long before the pandemic, and it's only worsened by COVID-19, putting this workforce into crisis. Roughly 1 in 4 of Florida's 700 nursing homes has reported experiencing staff shortages. And separately, extended lockdowns, lack of social activities, enduring loneliness and isolation from visitors have made many residents and families desperate to keep their loved ones out of long term care. At this time, the US has no federal long term care insurance program, leaving seniors with few options and many paying out of pocket for assisted living costs averaging more than $4,000 a month, and skilled nursing costs that range from $5,000 to $25,000 per month. As context, the average monthly Social Security benefit is only around $1,500 per month. So many seniors must impoverish themselves in order to qualify for Medicaid, which then covers the lion's share of residential long term care. Those in need of long term care have really very limited options. They can self insure, that is, they can draw on their own savings. They can purchase some type of long term care insurance product. They can rely on family and friends for care, or they can rely on Medicaid. AARP data shows that 77% of adults 50 and older want to remain in their homes for the long term. And that's a number that's been consistent for more than a decade. And yet, wait lists for long term home and community based services remain unduly long. In 2021, the Kaiser Family Foundation found that 41 states have waiting lists for home and community based services that altogether total more than 800,000 people. Now, Texas leads the way with 385,000 people on their waiting list, but they're followed by Florida with nearly 75,000 Floridians waiting for care, and then Ohio, which has almost 69,000. So, what's the diagnosis for what ails Florida's long term care system? Well, in short, it's the 3 C's: consumer confidence collapse. Are there treatments for the 3 C's? What can be done to restore consumer confidence in the long term care system? Florida must bring its residential facilities' long term care model into the 21st century, and continuing to do the same old things and expecting a different result will continue to hinder improvement and modernization of long term care. The underlying treatments build on the adage the best defense is a good offense. So, some possible longer term actions that we can take. For one, we can incentivize the building or renovation of long term care facilities that lessen the density of resident and staff populations, and which lend themselves to minimizing casual and professional contacts between residents, staff, visitors, and contractors in order to prevent viruses like the coronavirus from spreading so rapidly. As the demand for long term care increases with a surge in the older population in Florida, retirees in assisted living and nursing homes are no longer satisfied with the old model of care. Barren walls and a lack of real privacy characterizes many of these facilities, whose residents seem bored, unhappy, and most of all, lonely. The greenhouse model of care focuses on the patient and positions the nurses and doctors in the background. Each home typically houses between 10 and 12 residents who each have their own private room and bathroom. The greenhouse model uses more home-like environments, either new or remodeled or repurposed facilities that put a premium on housing and serving fewer residents in smaller, contained quarters with staff exclusively serving those residents. Greenhouse models have been used in Florida for nearly a decade. There are examples in places ranging from Jacksonville to Pompano Beach, and facilities and residents are embracing this lifestyle. There's also been some evidence that models like the greenhouse have been more successful in weathering the COVID pandemic. Now, the state could expedite the certificate of need applications for structures that are promoting less density of service and staff populations. The state can also incentivize long term care industries that implement this less is more concept by providing them higher performance quality measure scores, which is how we determine payment rates from taxpayer funds. The next thing that we should really be focused on is how do we serve more long term care recipients through home and community based services? Remember, the best defense is a good offense. So, home and community based services include programs that aid recipients and families, friends, neighbors, and other caregivers. For example, community care for the elderly, PACE, home care for the elderly, Alzheimer's supports, and respite for caregivers. Because these programs deliver services in recipients' homes and in their communities, they reduce opportunities for contagion in communal settings. Furthermore, home and community based services generally can serve 3 to 4 recipients with the resources devoted to just one long term care facility resident. Home and community based services are a wise and efficient investment strategy for taxpayer funds. As mentioned previously, our data show that the vast majority, 77%, of older adults prefer this. They'd rather age in their homes and stay in their communities. And the best way to make this happen is to minimize initial placements into long term care residential facilities. We can seek federal authorization through Medicaid waivers or state plan amendments that would make home and community based services the prime long term care placement for recipients. Under federal authorities, home and community based services are currently considered optional services, but the state could seek to change that, and they should. We can also increase budgeted slots for Medicaid long term care, home and community based services, as well as general revenue home and community based services. If we had a 10% annual increase beyond the increase in demand, we would gradually reduce those wait lists, which again are now in excess of 70,000 persons, and we can eventually eliminate those wait lists altogether. Those are great longer term options, but let's talk about what we can do in the short term. So, first of all, let's continue to implement CDC's safety guidelines regarding COVID-19. We need to implement rigorous recurring infectious disease training for long-term care facility staff. We need to make sure that we provide adequate personal protective equipment or PPE for staff and visitors. We need to require vaccination of staff, residents, and visitors, including boosters where appropriate. We need to require infectious disease training, frequently recurring, both for residents and for staff. We need to continue to embrace social distancing when it's appropriate. We need to find ways to use technology to enable remote services to help keep people connected and provide care. And we need to be caregivers for the family, the friend, the neighbor, those who are providing care. They provide over $32 billion of uncompensated care annually in Florida. And for caregivers, providing them some assistance, providing them aid is a great investment strategy for taxpayer funds because it will often forestall or even prevent recipients from needing more expensive care in a residential long-term care facility. We need to provide strict, comprehensive oversight of long-term care facilities by state and local regulators. We need to be sure that we require maximum reporting transparency by state and local regulators of enforcement activities and by long-term care residential facilities. The gaps in state reporting during the pandemic damaged the credibility of regulators and prevented the public from accessing vital information about the status of these facilities. We also need to reform long-term care facility operations. We need to do it now. Residents and families in Florida can't wait any longer. We need to increase nursing staffing levels. We need to augment with other highly qualified direct care workers. We need to incentivize through higher reimbursement rates for facilities with high acuity care need residents. We need to establish salary scales and benefits that are sufficient to attract and retain nursing staff and other highly qualified direct care staff. And we need to incentivize top performing facilities using performance quality measures. So what's the prognosis for recovery from the consumer confidence collapse, the 3 Cs, if you will? If Florida innovates, long-term care services will flourish. Florida must demonstrate its commitment to home and community-based services, long-term care placements. We need to commit to providing a home-like environment in nursing homes through embracing innovation and new methods, such as the greenhouse model. And we need to be committed to safe, meaningful assistance for residents of assisted living facilities. If Florida long-term care does not innovate, long-term care services will perish. If Florida does not implement these or similar proposals, then history will continue to repeat itself during future surges of the pandemic and in times of other disasters. Thanks for watching our video. If you have questions, please don't hesitate to reach out to AARP Florida. We can offer more in depth speakers on this issue and how long term care impacts families in our state. Email us at flaarp@aarp.org, or you can call us at 866 595 7678. Thank you for your time.